So now we get to the point of Venice Family Clinic, which is providing free and affordable health care to low-income folks on the west side of Los Angeles. And what does all of this change mean from our perspective? So in looking closely at the Affordable Care Act, what comes out of it for community health centers and community clinics is something that it's really increasing access to care, lowering costs of care, while increasing efficiency and improving the quality of care. So when we look at doing something like that in just Los Angeles County, we have to understand the huge shift that will occur. Currently, there are 2.2 million non-elderly people, adults and children, who do not have health insurance in LA County. Of those 2.2 million people, 67% have low incomes. Of the 45 member clinics in the Community Clinic Association of LA County, and that association is made up of free clinics, community health centers, and community clinics, all of whom essentially are seeing the same population. Currently, those 45 corporate entities that have well over 200 locations across the county are serving 643,000 uninsured people of the 2.2 million. So now we start to see where the work begins for all of the clinics, but all of the providers of LA County. It is anticipated, based on data through the Community Clinic Association that I looked at, that after 2014 and after full implementation of the Affordable Care Act, 923,000 people who are currently uninsured will have Medi-Cal, which is about 43% more folks entering Medi-Cal of the 2.2 million. And 786,000, or 36% of that 2.2 million, will end up insured somehow through the exchange, leaving in the end 446,000 people who will remain uninsured, which is 21% of the 2.2 million. And those folks are really uninsured because of citizenship and documentation issues. For clinics, what all of that means is really looking at our payer mix very closely and trying to determine what amount of uninsured we can continue to take and how much we can expand for the insured population, and what is that mathematical equation that leads to sustainability. And it's a very hard equation. So if we look at Venice Family Clinic, I was pleased because when I came to the clinic in 1994, 90% of who we saw were people who were uninsured. But because of lots of changes in children's health insurance, now 64% of the people we see are uninsured. But it's an interesting mix in that 80% of our uninsured patients at Venice Family Clinic are adults, and 20% of our uninsured are children. And that's because LA County and the state made huge gains over the years in terms of Medi-Cal, Healthy Families, and other county-based programs to get kids insured. So that type of thing should happen, hopefully, for our adult uninsured population as we move into healthcare reform. But then it raises a question, and I know that Mitch Katz was at this forum a few months ago, and his whole thing was saying, we, the county, need to move into taking care of these insured people, because if we're left with only the uninsured, we'll go out of business. Similar situation for community clinics. If we don't get that mix correct, and if Venice Family Clinic in the end continues to see only uninsured, we won't be able to stay in business. On the other hand, our mission is to see the folks that are most in need of care. So the question for us is, how do we do both well so that we can see all those folks that are uninsured while taking on more folks who are insured? If we're really lucky, about half of our uninsured will convert into insured folks and continue to stay with us. But it's not just luck, it's the skill that Tom talked about, which is that means really making sure we understand our business. Making sure that waits that might have been too long for someone that people who are uninsured might be willing to do because they have no other choice. The people who have a choice of where they need to go won't endure those types of waits. So we have to change our business. We have to provide better service. The things that clinics need to do include becoming patient-centered medical homes and really looking at patient satisfaction in a day in, day out way, measuring it, improving our quality, focusing on how to continue to provide care to the uninsured while taking a larger market share of Medi-Cal and folks on the exchange. Really making careful choices about growth and the infrastructure we have in place to support that growth. Determining where we fit into accountable care organizations, especially as there becomes Medicaid accountable care organizations. Creating more expansive relationships with hospitals so that we can truly increase the coordination of care of the population that we're serving. And then using two areas of expertise that really community clinics have almost more than any other provider, and that is the clinics across LA County are expert in chronic disease management. And this is a skill set that is in huge need as we move into our healthcare reform. And also the clinics are excellent at focusing on prevention, because the thing we've learned over the years is that if someone can't afford to pay, if you can prevent disease and prevent illness and keep them healthy, then they don't have to worry so much about ending up in the hospital. In closing, I wanted to just discuss briefly, looking at the title of our talk tonight, Year of Change, the Provider Perspective. At Venice Family Clinic, things are changing rapidly because for our patients, we are being asked to move them into vehicles now so that we're ready for 2014. The state has a saying, 2014 is now, and it's about our Medi-Cal program. But these rapid changes that have occurred as a result of the 1115 waiver between the state and the federal government have meant huge changes in our county in terms of how indigent care is paid for and the level of bureaucracy that all of the clinics now need to engage in to properly enroll people. The result of a shift that was made too quickly with too little infrastructure in place has been chaotic and horrible for clinics. And the example I'll use is that we were asked to enroll people in a new Healthy Way LA program. We've enrolled 1,400 people into the part of the program in which we're supposed to get more reimbursement. But the enrollment and eligibility systems were not in place properly for the county. So that despite 5 months of enrollment, we show 1,400 enrolled, the county shows 90 enrolled. Okay, we got a problem there, okay? It's 5 months in, and then there's the issue of how do you get paid when there's that kind of discrepancy. And the result for large contractors like Venice Family Clinic is that your payment is changing so rapidly that you can't predict it. And we are already $500,000 down in 5 months from where the regular indigent care program with the county was last year. Unfortunately, the new program was billed as a program in which we'd get more reimbursement, not less. So all of the clinics are struggling with this, and the worst part is we can't get data fast enough from the county to predict what we need to do to fix it. And it's a huge struggle at this point. Likewise, the move of seniors and people with disabilities into Medicaid managed care. Many folks that used to see those people as specialists and subspecialists aren't part of the new managed care contracts. So seniors and people with disabilities, lovely people who are very disabled, are showing up at our clinic having chosen us for this managed care contract. And we are seeing folks with a level of disability and care needs that we've never seen before in the history of the clinic. We knew they were enrolling, but we knew before we even got the enrollment lists that they had arrived, because we now have more people in wheelchairs and walkers in the waiting room than ever before. However, although we have excellent primary health care providers, when you see a gentleman who was diagnosed with tongue, neck cancer, a lady with multiple sclerosis and also multiple ulcers, and someone with giant cell tumor of the femur and testicular cancer, all in one day in your waiting room. All of them coming with lists of the specialists they used to see. It's clear that something's very wrong here, and that this departure into managed care without proper preparation has meant great harm to people can be done very quickly if we cannot get this righted. Overall, I have more concerns over the cuts to Medi-Cal because of the state fiscal situation, and then the enrollment of the Medi-Medis into managed care, given to what's now happening with our seniors and people with disability. So, although I'm very hopeful that healthcare reform will be a good thing once we've gotten to a certain level of implementation, the start of this has been very rocky and very rapid. And my overall concern is that although Medicaid expansion is coming and there'll be health insurance exchanges, if we don't have the right amount of payment to providers as we create these systems, it will not mean more access to care. Coverage will not equal access. And for this to be a success, coverage must equal access.